Hello, everyone. I'm here, Dr. Chuck Sampson, a member of the Restart Ed team, and we're trying a little something different this time. We're engaging in a video recap rather than a simple blog that we've been doing following our virtual town halls. And so I'm just going to give a quick summary of our fourth in a series of virtual town halls that occurred on June 24th. The Restart Ed team is a team of educators and professionals dedicated to rethinking, reimagining, and restarting our schools in a post-pandemic society. So, and the way that we're going to do that, and the way that we've tried to do that, is to crowdsource as many experts as possible, hear some of their thoughts, learn together, and then hopefully we can move forward. We've got a wonderful series of town halls set up throughout the summer. We'll be coming live to your Zoom dials on Thursday evenings, 8 o'clock Eastern, so please tune in. As far as the recap on our fourth virtual town hall, really awesome panel of experts in the field, superintendents, epidemiologists, nurses. So, you know, we had Dr. Wagner Marseille, superintendent of the Chettletown School District in Pennsylvania. We had Dr. Allison Buttenheim, Associate Professor of Nursing and Health Policy at the University of Pennsylvania. We had Dr. Denise Dietz, Associate Director of Epidemiology for Bristol Myers Squibb. We had Julie Scotto, Associate Director, Epidemiology for Bristol Myers Squibb as well. And we had Robin Cogan, a nationally certified school nurse and legislative co-chair of the New Jersey State Nurses Association. And this session was moderated by Dr. David Adderhold, superintendent of the West Windsor Plainsboro Schools and president of the Garden State Coalition Schools. It was a wonderful conversation. A couple of, I think, the topics that would be pertinent to folks to really take a look at as states across the country have released their guidance and their guidelines and their frameworks for reopening schools. There was a lot to debate there amongst the panel. Some real discussion on how to most effectively manage some of that shifting guidance, how to work together to do that from the State Department of Ed's on down. In particular, some concerns were raised around the distinction between specific guidelines and things that are mandates, and how educational leaders can navigate that minefield. There were some best practices shared for masking, cohorting, and potting. Potting in particular arose in the conversation as something that school districts may want to take a deep dive on. And there was a lively discussion on the role of contact tracing and what schools should or should not be doing around that. We also talked a lot about what's been learned over the past couple months as it relates to transmission. And so as school districts, as faculty and staff members look to return, and as schools build plans to protect their faculty and staff and their students from exposure, I think understanding the way that this virus, COVID-19, is being transmitted is well worth your time to check out. There were some hard truths in this conversation about temperature checks too. Might make some folks rethink how they're doing some of these temperature checks. And we know, a topic, and it leads right into our session on July 9th, is engaging in trauma-informed pedagogy and how important that is. That was a topic of consideration as well. Scheduling options were looked at. You might find it interesting that the experts in the field in terms of transmission thought weekly attendance and then shuffling off for a week might be the most effective to limit exposure. And then the minefield of testing and what schools should be or should not be doing and the requirements and where we fit was also discussed. So it's a quick recap of some things we discussed in session 4. We've got sessions, Restart Ed has sessions lined up throughout the summer. Every Thursday night at 8, as I said earlier. I would love for folks to join us. We are really attempting to crowdsource solutions from experts to help assist all of us in planning this new normal. Thank you.